Well, it sounds like we lost our music there, but I guess I will start us off and want to welcome everyone to the Self-Sufficiency Partner Call. It's our monthly Thursday, second Thursday of the month call, where I just had this idea. It almost feels like we have a variety show newscast. So we're covering all sorts of different topics that I hope will be of interest for you and your clients. And so with that, starting us off, let's hear about this brand new program with paid family leave. And Monica Zayura from the Employment Department, I'll turn it over to you.
Wonderful. Thank you guys so much. Good afternoon. We're very happy to be here today. We're going to get ready to load our slide deck.
Okay, that's me. I'm frantically trying to pull them up. Give me a quick second. There it is. I was using Teams all morning, so it's like having to switch over to Zoom. Okay, hope everybody can see them now.
Yes.
Yeah, that's great. Thank you, Zaira.
You're welcome.
Thank you, James, for the introduction. Once again, my name is Monica. I'm an outreach program analyst with the paid leave team. Thank you guys again for having us. Today, we're going to spend the first few minutes providing an overview of the program, kind of including all the topics you see there on the slide. Please keep in mind that we've shortened our presentation to accommodate the time we've been allotted, but we definitely want to invite you folks who are interested in more information to join one of our community conversation sessions. Those take place every Thursday from 3 to 4, and we'll drop a registration link into the chat. So we'll jump right on in. What is Paid Leave Oregon? In Oregon, paid leave is for up to 12 weeks with 2 additional weeks possible for pregnancy-related conditions. Any employee who has earned at least $1,000 in the year prior to claiming and experienced a qualifying event is potentially eligible for benefits. The leave categories are broken down into 3. That is family leave to care for a family member with a serious illness or injury, or to bond with a new child after birth, adoption, or foster care placement. Medical leave during one's own serious health condition, and safe leave for survivors of sexual assault, domestic violence, harassment, or stalking. So we're currently heading into the final months of implementation for Paid Leave Oregon, and we're still on track to meet all of our major deliverables. We started accepting equivalent plan applications September of 2022, and we'll begin withholding contributions in January of 2023 and paying benefits to qualifying individuals and issuing assistance grants in September of 2023. So the hot question is who's covered? Paid Leave Oregon is going to cover all employers in nearly all employers in Oregon, including nonprofits, S-corps, and religious organizations. All employees, except employees of federal and tribal governments, are required to participate in the paid leave program. Tribal governments, self-employed business owners, and individuals who have been correctly identified as independent contractors may choose to participate by notifying the paid leave program and choosing to opt into coverage. So contributions will be a percentage of wages paid by both employees and employers, and it is how we are funding the Paid Leave Oregon program together. The contribution rate or percentage for paid leave is set annually no later than November 15th by the Employment Department and cannot exceed 1% of gross employee wages. The rate for 2023 is 1% of up to $132,900 in wages. Earnings over that amount are not subject to contributions. The 1% rate was set after 2 years of analysis and actuary data and numerous discussions with our advisory committee that is made up of members representing businesses, worker, and community voices. There are a number of reasons why this rate was chosen, but it will be reevaluated every year. Employees will pay 60% of the contribution rate, and large employers will pay 40% of the contribution rate. Small employers with fewer than 25 employees are not required to pay the employer portion of contributions. As an example, if you earned $1,000 in wages this month, the employee would pay $6 and the employer would pay $4. The employer may choose to pay the employee portion as a benefit for their employees. Paid leave also provides job protection for eligible employees. As an employee, your job is protected if you've worked for your employer for more than 90 days. This applies to both large and small employers. If that position no longer exists, the employer may choose to place the employee in a different position with similar job duties and with the same pay. It is also a requirement to continue healthcare benefits while the employee is on leave. One question we get frequently from both businesses and individuals is what payroll contributions might look like. This slide shows examples of what the contribution amount equals for different types of wage earners. As an example, a minimum wage worker would annually pay $168 and a business would pay $112. 1 week of paid leave benefits for that same individual would be $540. Lowest wage workers will receive 100% wage reimbursement, with less than 100% for those workers in middle and high income jobs. The state average weekly wage through the summer of 2023 is $1,224.82, and the minimum weekly benefit amount would be $61.24, with a maximum weekly benefit amount of $1,469.78. So the Oregon Employment Department's new system, Francis, is now ready for use. Francis Online will replace the Oregon payroll reporting system and the employer account access portal, beginning with the third quarter filing in 2022. The new system will support combined payroll reporting, including unemployment insurance tax, workers benefit fund, state withholding tax, lane and TriMet transit taxes, and beginning first quarter of 2023, state transit tax and paid leave Oregon contributions. This is actually where folks will be able to go and file for their paid leave Oregon claims also. Learn more about Francis and file specifications at francisinfo.oregon.gov. So we'll do a brief little recap before we turn it over and see if maybe we can answer a few questions. The contribution rate for 2023 is 1% of gross wages. The employee is going to contribute 60% of that contribution rate. Large employers will contribute 40% of the contribution rate, while small employers can choose to contribute the employer portion. As in any employee who earned at least $1,000 in the year prior to claiming paid leave may be eligible for benefits. So feel free to put questions in chat or raise your hand and we can call on you. It looks like we have a few minutes left.
So this is Martha Brooks. I have a couple of questions. So all employees across the state, no matter size of employer, will pay 40%, and there's not an opt-out. Like, I kind of got the impression this is more for younger families, not older employees. Can you kind of explain?
Sure. So the employee contribution is the 60% of that 1%. And I feel like it is all inclusive. Not only do we provide that family leave, but we're also providing medical leave during one's own serious health condition and safe leave for survivors of sexual assault, domestic violence, harassment, or stalking. And it's really intended to just cover some of life's like most important and sometimes unpredictable moments. So I think that can really happen to anybody. Now, if Zaira wanted to add on.
Yeah, and that's all employees across the state. Like if you have a business of 5 or 6, the employer doesn't pay, but the employee still pays.
That is correct. Yes, Martha. So all employees will be required to contribute into the fund starting in January of next year. And then in September, it's when you will be able to apply for benefits or receive benefits, depending if you have a qualifying event. And then also the other thing this program offers is if you have someone who is ill, who's a family member, you can also take time off to care for them. So they don't necessarily need to be a young adult or a young family. It could be for anybody like a parent.
Okay, thank you. That clears it up. At
Yeah,
least
for sure.
a moment. I'm sure there'll be more questions once you start to implement.
Yeah, I do have the screen up with our contact information. I know we don't have a lot of time during today's call, but if you do have other questions, feel free to email us and we do respond back within 2 business days. So happy to answer any other questions that you may have.
And the Zoom link for our community conversation sessions was dropped in chat at 2:06. Feel free to sign up for those sessions where, like I said, we have a more robust presentation, but due to our limited time for today, we had to condense it down a little.
There is another question in the chat from Alma. Is paid leave Oregon apart from short-term disability insurance?
It is. So it's a standalone program. Short-term disability and long-term disability will still be there, unless your employer chooses to change that as an option. But for now, yeah, paid leave is on its own, and short-term and long-term disability will sit on their own as well.
Yeah, at least for the purposes of our program, we won't even ask about short-term disability or long-term disability plans. So you can go ahead and apply for ours, and it won't disqualify you if you do decide to apply for a short-term disability plan. We do ask though that people check in with those disability plan providers to make sure that they allow it as well.
Okay, I think our time is up. Looks like we've dropped in, like I said, that Zoom link there if you guys want to sign up for something else. And we can also drop in chat the link to our website.
Yeah.
Because there's a lot of really good information there.
Yeah, so we're gonna drop so many links in the chat. Sorry, James. So we're also gonna drop a link to our survey. We ask all of our community members if they can help complete that. It takes about no more than 5 minutes to complete, and it just helps us improve on our presentations, and also capture demographic data, which is completely voluntary if you want to provide that. Yeah, so thank you for the time.
Well, thank you so much. Yes, this is definitely short attention span theater here, but I hope people, can get their questions asked and know where to go for more information. So I really appreciate all the links. And I suppose I jumped in and I didn't introduce myself and my co-host, but I'm James Barta with Self-Sufficiency Programs doing community engagement along with Xochitl Esparza. Go ahead, Xochitl.
Hi, welcome. I'm Xochitl Esparza, she, her pronouns, Office of Self-Sufficiency.
And we are delighted to have you here today. So, but in that interest of moving on forward, I see Jessica McGraw joined us, and I believe Christy is also with us. Is that correct?
Yes, we're both here.
Wonderful.
And we do have a deck to share if you don't mind giving me a moment to bring it up.
Not at all.
All right, can folks see my screen?
Yes.
All right, great. Then we'll go ahead and get started. So thank you for sharing some time on your valuable agenda with us. I'm Christy Sinatra. I use she, her pronouns, and I'm the Senior Communications Advisor at the Oregon Department of Human Services. And my presentation partner today is Jessica McGraw, who's representing the Oregon Health Authority. And we're here today to share some information with you about the COVID-19 public health emergency. Right now, we both are serving as co-leads for the communications branch of something called the Joint ODHS and OHA COVID-19 Public Health Emergency Unwinding Project. And because ODHS and OHA serve so many of the same people, the departments came together earlier in the year and decided to create a joint project to prepare for the end of the COVID-19 public health emergency. The scope of the project is primarily the benefits in the one system. And the idea behind it is that a coordinated approach will make what will be a difficult transition for so many a little bit easier and a little bit less confusing. In particular, the project is focusing on the Oregon Health Plan, long-term services and supports, and food benefits through the SNAP program. I'm sure this group is very familiar with the policy flexibilities we've benefited from throughout the pandemic, such as continuous enrollment in the Oregon Health Plan, despite any changes in your circumstances. And then also the temporary benefit programs and flexibilities within SNAP, including the emergency allotment food benefits that brought a sizable boost to many people's and families' food budgets throughout the pandemic. So when the federal COVID-19 public health emergency ends, many of these temporary benefit options are going to end or they'll phase out. And we know that the impact on so many is going to be substantial. So as we unwind the PHE, you'll see that these are our primary goals. Our goals are to ensure we can continue flowing benefits to people who continue to qualify for benefits without interruption. And as people either see benefit reductions or losses of benefits, that we're able to connect them with resources that may be able to help them fill the gap. I think that we're all working in this world throughout the pandemic, and we know that in particular for people receiving SNAP, there's going to be a very difficult hit to their food budgets on top of inflation. And so we are putting together some toolkits and some resources that we'll be asking you to help us with to get the word out to people so that we can help connect folks with resources to attempt to fill gaps and help them to start planning for these changes when these changes come. Jess will share a few more specifics about that in a moment. So even though the burning question about the public health emergency continues to be, when is it really going to end? And we don't know for sure when it's going to end yet. The federal government is required to give us 60 days notice before they end the COVID-19 public health emergency. We haven't received the 60-day notice right now. We just got word today that the public health emergency has been extended into January. And so January is our new target date for planning and preparing for the end of the public health emergency. But take that date with a little grain of salt, because as we've seen throughout the pandemic, it is subject to change. So what you see before you here is our approach to how we'll be communicating. And this is organized by communicating in 3 phases. And we're using our time now to prepare for all 3 phases of communication for when the PHE ends. Right now, we're in phase 1. Which will carry us through November. And in this phase, we're really concentrating on encouraging people to update their contact information so they get critical information about their benefits in a timely manner. The second phase will begin in November. And at that point, if we know the end date for the PHE, then we'll start communicating that date and making sure people know what to expect and what they need to do. The third phase will be the longest phase. And this will be the phase when things like medical redeterminations will be happening. And during that time period, we'll be also making sure that people are opening their mail and their messages from the department, that they're acting quickly on requests that they get from the department, and that we're also working with community partners in our teams to make sure that we're promoting any available resources that might help people with transitions. All throughout this communications phase, we are incorporating feedback as it comes in. Feedback has been critical to us in meeting the needs of the people we serve all throughout the pandemic. And that will be the same as we exit the public health emergency. And I think I'll turn it over to Jess now. She's going to give you an overview of some of the activities that are underway now and some of the things we have coming online for partners and providers like you. Since we know that as things change, many of the people we serve will turn to you first for information and resources about what to do and what to expect. So with that, I'll hand it over to Jess.
Thanks, Christy. And I'll quickly introduce myself to everyone on the call. As Christy said, thank you for having us during this time. My name is Jess McGraw. I am co-leading from the Oregon Health Authority side. I use she, her, hers pronouns. And I am a white woman in my mid-30s with long dark hair. Today, I am wearing a long sleeved white shirt and red glasses. My background is blurred. As Christy mentioned, we, despite having shifting timelines and not knowing for sure when the public health emergency will end, we have broken up our communications and outreach into 3 distinct phases. And as she mentioned, we are squarely in phase 1. And it's more of an evergreen message, right? Like this is something that we're always encouraging people receiving both medical and non-medical benefits through the one system to constantly be updating their contact information. So there's nothing really new there. We just are trying to kind of overemphasize or over communicate the need for anyone receiving benefits to be doing this and checking and verifying their contact information, reaching out to us or through preferred channels to get that information updated. So we have kind of a whole slew of tactics that we're using right now in the fall in this phase 1 period. As you can imagine, a lot of this work requires us to be well coordinated internally. Like Christy was saying, this is a cross-agency approach. In particular, on the ODHS side, we have plenty of folks who work directly with people receiving benefits. So part of our efforts have included internal communications like transmittals and talking points and scripts and so forth, so that anyone who's working in a local office or working through the call center has information in hand to continue to remind people on every call or in every interaction, hey, have you updated your contact information lately? Do we have the latest information for you so we can reach you at any point in time? We also started a direct mailing, and I'll go a little bit deeper into this in just a moment. This is going out to all people receiving benefits through the One system with the goal of really baselining any bounced addresses. So the hope is to give us a sense of just how many people in our system do we not have the most up-to-date contact information for, as that will be highly consequential once we move into phases 2 and 3 and actually need to make sure we are getting into contact with folks, letting them know if something's going to change for their benefits post public health emergency. What steps do they need to take to either keep their benefits or transition to other forms of benefits or services? Part of our work with external partners includes developing a toolkit, so all of you will have the same information in hand and be able to use through the channels that you already use to communicate with the people you serve. So we do, as Christy mentioned, have a toolkit. We're currently passing it through translations in the top 12 languages of people receiving benefits through the One system. We're hoping to get that out as soon as next week, so absolutely stay tuned. We do have a slide a little bit later that will touch on some of the tools that you can expect in that toolkit. We also launched a monthly webinar series last month in September for all partners. So whether they're supporting people as Oregon Health Plan certified community partners, whether they're community-based organizations, reps, whether they're providers, insurers, all types of partners are welcome to these webinars. It's really just a chance to connect and hear from policy, operations, and communications and outreach staff doing this work about the latest and greatest of what OHA and ODHS are doing together to plan and execute for PHE unwinding efforts. Those webinars are intentionally spread between, or I guess inserted in between the Centers for Medicare and Medicaid Services webinars. So we're constantly trying to bring some of the latest information at that level, as well as Oregon specific information through our webinars. And we'll share a little bit more information about that and how you can partake if you weren't at our September webinar. We have one just next week and one in November and December to close out the year. And then lastly, it's worth mentioning that we have brought on a contractor to support us in developing a more fulsome community outreach campaign. That will also include paid media at some point in time. We are likely going to learn more about what that will look like in later phases, the paid campaigns, ad campaigns specifically. So more to come on that likely in January of next year. Next slide, please. Thank you, Christy. So just going back to that direct mailing very quickly, this is something that we sent out to all Oregon Health Plan and Medicare Savings Program recipients. We began these mailings in the week of September 26th at a rate of roughly 25,000 letters per day. Those will continue to go out through October. The message really is, if you haven't received a letter from us by the end of November, it means we do not have your most up-to-date contact information. Please reach out, please update your contact information as soon as possible. A big part of this tactic, again, as I had mentioned, is to see just how much returned mail we get. It's been a couple of weeks since we began the mailings, and I think at our current rate, we're seeing roughly a 4% return rate, which I'm not the math person in the room, but currently that sits us at about 15,000 bounced addresses. And if that trend holds up, I mean, we'll see much more coming in over the next couple of weeks. But we will in all have a pretty good idea at the end of the exercise of just how big that gap is of outdated addresses that we'll need to work with our partners to support us in filling or bridging. A big part of that is that we are now approved to be able to gather contact information or address updates more specifically from coordinated care organizations. This is not something that we had been previously able to do without having to go back and verify the addresses with the benefit recipient. So that is a big policy change, waiver, a big time waiver approval that we needed to be able to support us in this work. So as you can imagine, we are working closely with CCOs to help us bridge the gaps as we identify returned addresses through this tactic. Next slide, please. And hopefully next week we will be launching this partner toolkit in a variety of languages. We'll see how quickly we can get that through all of our final review approvals and translations processes. But what you can expect from that is messaging for both phases 1 and 2. So what we're doing right now, which is update your contact information, that more evergreen message, as well as for phase 2, hey, we got notice. This is what's going to be happening. Here's how you can prepare, and creating a little bit more urgency around the need for folks to update their contact information as soon as possible. So just some of the tools that you can expect include everything from copy for websites, emails, newsletter, articles. If you do SMS or text messaging through there as well. It also includes phone scripts for call center staffs, chatbot text, and as well as social cards and flyers for those who want to use them or are able to use them through their social media channels, and or would print and post flyers throughout their buildings. And next slide, please. So as mentioned previously, we have a variety of ways to stay informed, including a dedicated partner page. So I'm going to skip down to that second row, if you will. You can visit oregon.gov/COVID-PHE to reach our landing page for kind of a more fulsome display of information related to the COVID-PHE efforts. Off of that landing page, we offer a page for benefit recipients, as well as a page dedicated to our partners. And that is at COVID-PHE-partners for that partner page. On that page, you'll be able to access our webinar materials from September's webinar. You'll also be able to register either off of this slide using the QR code or off of that website for our future webinar dates. Again, we have one just next week, as well as a November and December date for our webinars. We also have a running Q&A from those webinar series for partners of questions that we've received. Certainly useful information to go and take a peek at. And then lastly, Christy had mentioned we are collecting feedback, and we're doing this more formally through an app that we have. And the email for that app is covid.19@dhsoha.state.or.us. It's on this slide. That is a good way to send questions, comments, concerns, anything that's coming up for you over the course of this work, for it to get to us and for us to be able to prioritize responses based on if there are equity issues or other types of barriers that you are noticing or are coming to you through the people that you serve. It's a fantastic way to get that information into a central location for us to be able to act quickly on anything in particular that's equity related, as well as just get you information if you have basic questions or have other needs. And with that, Christy, would you like to take us home?
Sure. Well, I think we're at time. And so I guess it's up to our hosts whether we're able to take a question or two if there are any.
Well, I am certainly interested to see if there's a quick question or two. I know I'll say while you're thinking about your question, with the email, the last email from yesterday morning, there was a flyer that had the links for these webinars that are coming up starting next Tuesday. So I encourage you to take a look at that. Any questions? I'm sure there will be more to come, though. So Christy and Jess, thank you very much.
Right, and thank you, James. We look forward to getting that toolkit into James's email box so he can share it out with all of you. Thank you all for your time.
Thank you, everyone. Hopefully we'll be able to visit again. Have a good day.
And we'll move on to our next section. I'm glad to see Jen Corbridge, our SSP policy advisor, is here, where she can describe the SSP POPs. And I'll just say, not just housing. I don't know why that got in the agenda like that, but Jen.
Good afternoon, everyone. Jen Corbridge. I use they, them pronouns, and I am the policy advisor for self-sufficiency programs. I'm a policy advisor, self-sufficiency programs. I know I only have 10 minutes, so I'm going to do kind of a high level run through. And I'm going to put my email in the chat in the event that there are questions that folks have and want to follow up on. I'm also going to put the ARB link into the chat. Do with that what you want. I think it's like 1,200 pages, but you can do maybe like a text search. So I'm going to share my screen. Please hold. Okay, so self-sufficiency programs had put forward 4 POPs in the agency request budget, hence the acronym that I used earlier, ARB. And I'm just going to go through them high level. There are a number of folks on this call who can speak to the specifics of some of these. So I hope my colleagues don't mind if I call them out should questions come up that I am not equipped to answer. So the first POP in the amount of $84 million general fund would be to expand the housing stabilization program that's currently run out of OHCS. And it does a number of different things. It increases funding to CBOs to build a network of housing navigators. It expands the eligibility criteria, which I now think is limited to only folks who qualify for TANF, to include anyone who qualifies for a self-sufficiency program. So I believe up to 200% of FPL. It creates an incentive fund for landlords to rent their properties out to folks who qualify for these programs. And then there's also new contracting opportunities that prioritize culturally specific organizations. I'm going to go point by point and stop in the event that there are questions, or Ashley, if there's anything that you can add about this.
I think you covered it pretty perfectly, Jen. I think the only thing I'd add is that we've really envisioned and crafted the details of this POP in close partnership with our peers over at Oregon Housing and Community Services. We've had a really aligned partnership through this process, and I think a real vision that it takes more than one state agency to tackle the housing and homelessness crisis that's in front of us right now. So for our OHCS partners on the call, thank you for joining arms with us in this.
I can't see the chat or any hand raising, so just call it out. Or James, you can monitor that. All right, so I'll go ahead and move on. So the next POP in the amount of $13 million general fund is expanding the youth experiencing homelessness program. And basically this basically entails enhancing the existing programming and maintaining recent investments, because I believe that was one-time funding. Developing a direct cash transfer pilot project for youth experiencing homelessness, creating and supporting a statewide youth advisory board, and providing paid internships for youth with lived experience. I think in addition to really trying to lift up the voices and pay for the time of youth with lived experience, we're really trying to center that, as well as increase these program investments to reach rural and tribal communities. And Sochi, I know that Sochi has been instrumental in this conversation, has really driven this conversation along with our colleague Matt. And Sochi, if you have anything to add, I don't mean to put you on the spot, but if you have anything to add, please do.
Jen, I think the only thing I would add is similar to what Ashley added. There is a partnership with Oregon Housing and Community Services with respect to working with youth experiencing homelessness, and I'm very thankful for the partnership. This POP advances some of the work that has started last year, more so this year, and as you said, it continues the investments that are time limited to this biennium.
Right. Any questions?
Jen, just a question in the chat of, will we get these slides out to everyone?
Sure thing. Yeah. The next is coming back to request the remainder of the investment for the Survivor Investment Partnership. There were funds allocated to ODHS in the 21 session. And basically this package is coming back to ask for the remainder of that request, plus some additional staffing, really with the idea of putting more direct financial supports into the hands of survivors and our very, very important and critical partners. So who administer these services and supports. So tribal domestic violence, sexual assault agencies, culturally specific DVSA agencies, and our co-located advocates. I know that Kirsten's on the call as well. If you wanted to say anything or add anything, please feel free to do so if there's anything that I've forgotten.
Thank you, Jen. Nope, you've captured that. I think that, the one point I just want to make is that our original ask didn't allow for all of the funding. And so this was really an ask to fill it as we had originally hoped. We are going to speak a little bit more to Survivor Investment Partnership in a few minutes. So thank you, Jen.
Yeah. I see the little icon. Is there another question, James? All right, great. And then finally, I know that there are a number of partners on this call who have been involved directly with the TANF redesign partnership. Basically, this was a joint proposal put together by the TANF redesign partnership in partnership with the Poverty Relief Task Force on what I hope will be sort of an ongoing process in redesigning Oregon's TANF program. The proposals include increasing the monthly cash grant to 50% of the federal poverty level. Currently, I think it sits at around 33 to 35%. Using the same eligibility standard for all families. Right now, we have an eligibility standard called the No Adult Standard, and it really penalizes families who live multi-generationally or with other families, because we know that folks are doubling up because affordable housing and stable housing is really out of reach for a lot of our neighbors and community members. Ending time limits, taking away benefits from financially insecure households is not something we want to be doing, especially when folks need the support the most. So we'd be ending time limits for the adult on the TANF case, and then expanding eligibility to historically excluded communities, undocumented folks, parents and caregivers specifically, and people who are pregnant for less than 8 months. And the general fund ask for that is $119 million and a support of federal fund limitations of $25 million. Oh, why does that look weird? Okay, well, questions? Let's stop sharing.
Thank you, Jen.
I know that was a lot of information, so I'm going to do two things. I'm going to drop my email in the chat in the event that there are additional questions, and I'm going to drop the agency request budget document in the chat. It takes a little while to load, so you've been forewarned.
Jen, for those of us who cannot remember, could you just super briefly go through like what happens now? And these pops are being requested, like when do they get decided on, and when should we pay attention to figure out if they're funded or not?
So that is a great question, Beth. Thank you. We are in an interesting kind of position right now because we are changing governors. So it does not look like, I don't believe in this process that Governor Brown will put out a governor request budget and that the new governor will put out a governor request budget. And so I think for advocates on the call, this is an opportunity to start having those conversations, especially around POPs that are pertinent to the populations that you serve, and also, you know, various other legislation. So I think there is a long way to, all of that is to say there is a long way to go. And this is by no means a done deal. We will go through a process with the Department of Administrative Services and what gets recommended to the new governor. But that process is still happening. This is my first go around with agency request budget stuff. So I believe that's the timeline, unless I forgot anything, James.
The new governor will come in and have her own budget that has to be released by February 1st.
Yeah.
We'll likely know before then, of course, but that's when we'll definitely know.
Yeah, it's an interesting year this year for budget things.
Yep. So
Thanks so much for the opportunity to share space with you all today. And I please, if you have any other questions, please don't hesitate to reach out.
Thank you, Jen. And I once again appreciate all the brevity and all the information packed into a short time. And speaking of which, I'm going to turn it over to our SNAP policy team to talk about SNAP and PEBT updates. So Lucy, I'll turn it to you first.
Yeah, hey, good afternoon, everyone. Lucy Huffman, Food Program Coordinator, also with SNAP Policy. Really quick updates for us. Just want to announce that our emergency allotments are continuing through October, and we will apply for those again in a couple of days. We have to apply for them on the 15th. So we will be putting in our request for November benefits to keep those going. And I have a bunch of press releases, and I'll put those in the chat so that you guys can have that information in writing too. So the emergency allotments, we also have received a waiver to extend the time limit that Oregonians who might have lost food due to the wildfire evacuations or public safety power shutoffs in August and September have. So folks now have until October 24th to request replacement SNAP for food that might have been lost during those events. And then the last thing I have is that the usual kind of annual COLA increase happened for SNAP. So those benefits increased in October. And for an example, the maximum food benefit for a household of 2 went from $4.59 to $5.16. Maximum food benefit for a household of 4 went from $8.35 to $9.39. So that's just, we do those adjustments. The federal government does those adjustments every year. And so that has gone through. And I will turn it over to Stephanie, who will talk about PEBT.
Hi, everyone. Good afternoon. My name is Stephanie Cook, and I'm a SNAP analyst here at ODHS. So I wanted to share about Pandemic EBT and the payment that we're going to be issuing at the end of this month. So Pandemic EBT is a benefit, a food benefit, so not a SNAP benefit, but a food benefit that is issued to children who missed meals due to their child care facility closing because of COVID-19. So the payment that we're issuing at the end of October is for school year 2021 and 22, and it's for children up through age 6 who were part of an active SNAP case. And so the kiddos that fall into this category will receive $63 for each month that they are eligible between September 2021 and May 2022. So it's a benefit that goes back in time. Those benefits are going to be issued directly onto the SNAP household's EBT card, and they will be issued between October 27th and 31st. So right at the end of this month. And that's all I have for PEBT.
And that was a lot of information in a short amount of time. Again, there's a public facing PEBT page too, right?
There is. I will put the website address in the chat.
Thank you. It's my pause for questions.
James, can I ask a super quick question?
Please.
Beth? I'm so sorry, I'm out of touch right now, but why is that one limited to kids who are already enrolled in SNAP? at some point it was available, the PEBT benefits were available to kids even if they weren't enrolled in SNAP. When did that change, or why did that change?
Yeah, that's a great question. So this one is due to limitations of data information that the education department was able to share with us in order to issue those benefits. We were only able to be approved for a plan that would issue to children under 6 that are already on SNAP cases. So that's why it only serves that group of children for this go around, but we're exploring options for pandemic EBT for summer 22 that would expand that group.
Okay, just to point out to everybody, that means that excludes all kids who don't have the immigration status to qualify for SNAP, and or whose families, like for one reason or another, didn't want to, like, were afraid to access SNAP or something like that. So that makes me worried that those folks are not able to access that pandemic money.
Well, Beth, thank you for pointing that out. I'm sure some advocates will have some words about that for the coming legislative session in general too. But any other quick comments? So next in our rapid fire section of the agenda, we have Kirsten to talk about, as she already alluded to, the Survivor Investment Partnership, along with some colleagues, but Kirsten, I'll let you handle that.
Good afternoon. Thank you, James. Yes, it was a great tee off, Jen. Thank you for that. I'm Kirsten Sands. I am go by she, her pronouns. I'm the program manager overseeing the domestic violence programs within self-sufficiency, one of which is our Survivor Investment Partnership program. I really want to turn this over to my colleague, Marcy DeGuire, who is going to share a presentation with you today. The Survivor Investment Partnership program has been developed with the 9 tribes of Oregon, culturally specific domestic violence and sexual assault survivor agencies, as well as our co-located advocacy agencies. And today we're going to spend some time talking with you about an opportunity for 2 positions that we are hiring here at ODHS to help really kickstart and provide some more resources to get this project off the ground. So there's lots more information that is going to come, as well as more information about the POP. And so without further ado, Marcy, take it away.
Good afternoon. Marcy DeGuire. I use she, her, hers pronouns, and I work in the Office of Self-Sufficiency. Because we are such short on time, I think we can probably skip through the overview. I think Jen and Kirsten both talked about that. If there's any questions, if you want more information about it, feel free to contact myself or Kirsten, and we're happy to share more information because we have lots. Part of the POP, this POP, the partnership investment partnership, we received a couple positions within ODHS, and the positions, they're really for implementation of the program, ongoing program integrity and sustainability, as this will be an ongoing program. The positions that we are currently looking to fill are, we have an Operations and Policy Analyst 3, which you see the slide that Sam has. Thank you, Sam Palacio, who is our project manager. And then we also have a Program Analyst 2 position. They are both in the process of being posted. We've been working in collaboration with our work group that includes the folks that Kirsten talked about. That we have members from our 9 tribes of Oregon, culturally specific partners, and co-located advocacy agencies. We worked in collaboration to identify attributes and for these positions. We worked with them to create a flyer for marketing, position overviews, and recorded a couple videos to discuss or to just talk about the program itself and the position. Because we know that sometimes postings for ODHS it's a little technical, so we wanted to kind of bring it more to real life. This is what these positions are and what you're going to be doing. Hopefully, they are new positions, so we don't know what we don't know. So we'll probably have to tweak things as people get on board and we learn more about the needs of the project or the program. So the resources that that I spoke about will be available in the Workday postings. They will be available in the flyer that I don't think we have on our slideshow, but we can make it available. We're just waiting for the posting to go live so we can add the live links into the flyer. We will be distributing the flyer via email to our work group members and organizations that they have identified to hopefully reach people within the communities that we are hoping to serve with these funds. And we're lucky enough to have Wednesday Calhoun to guide us through. She's a senior tribal recruiter in recruitment, and she's so excited to be working with us to fill these positions. We are just a few days away from finalizing the postings, and they will go out. They'll be posted for 3 weeks. And then at that time, we will be looking at the interview process where we develop questions and identify panel members with our work group. And we're hoping to have these positions hired, I'm going to say before the end of the year. I know that's still months out, but we don't know how many people are going to apply, how many rounds we'll have to interview for. So hopefully it'll be before then, but I think it's safe to say before the end of the year. So that's a rundown on the positions. Did we want to look at the funds, or do we have information? Sam, do you want to go to the next slide that talks a little bit about the distribution? This is a part of the project that we are pretty much beginning right now. We know that we have 9 tribes of Oregon that we'll have interagency agreements with. So we're going to start that process soon. We're already in conversation. We also have grant opportunities for our culturally specific providers, which we are working to put in the RFA for that request for application. And then, of course, we have funds for our co-located advocacy agencies that will add on top of what they've already are contracted for. Next slide. So the next 3 slides just talk a little bit about the process of each of the avenues, the IGAs, intergovernmental aid agreements. And we decided actually today in our work group meeting that we will, this #1 collective meeting with all the 9 tribes of Oregon, we are not going to do that because we are so behind the ball. So we're going to jump into that transition to meeting individually with each of our 9 tribes of Oregon. And I think that will take us a little time because we have not done this yet. So we need to learn how to communicate with I guess I should say because I don't know where everybody else's level is of communication with our 9 tribes of Oregon. So yeah, we will be in collaboration, working to figure out what their agreements will look like, because it really is them driving the work, not us. All right, next slide is the grants. So as I said, the request for application, we're working on that. The policy option package, we were approved 8 grants. So 8 of our culturally specific providers will receive funds from the Survivor Investment Partnership. and we'll work in collaboration to develop the contracts with those providers as well. And then the next slide talks about the co-located advocacy agencies, who they all currently have contracts right now. So we will add an amendment to each of those to include language from SIP, or our Survivor Investment Partnership. Okay, yes, so that is, we don't have any more time, so that is our presentation. If anybody has any more questions, I think this slide deck, will be available for you. You can reach out to myself, Kirsten, Sam. So thank you for the opportunity.
Thank you, Marcy. Yes, and I know we're almost to time, but it does, if this is an important opportunity to get grant money out, for survivors, for communities to help survivors. And there are other grant programs going on. So in our last few seconds, basically, I want to give Tina Gorin a shot at describing her program. Well, the program that she's working on, I shouldn't call it her program, but Family Support and Connections. Tina.
Hi, thanks, James. Hi, all. Tina Gorin here, coordinator for the Family Support and Connections program. The small sort of soundbite about what our program is that we're a contracted network of community-based organizations that provide primary and secondary services in all ODHS districts covering all counties in Oregon. And we have an exciting opportunity for some funding currently that begins with a request for application. Really, the goals of this funding opportunity and the expansion of the program is to strengthen our current network of Family Support and Connections providers along the continuum of prevention services, to expand the current network to include culturally specific organizations, focus and prioritize services for populations who have been historically and presently underserved, marginalized, or overrepresented in the child welfare system, and to strengthen the cultural responsiveness and the capacity of the services that are available through this program. As I mentioned, we have a request for application. It's posted currently in the Oregon Bias system. The deadline to apply for this is November 16th, but can be extended if needed. We have a single point of contact who's Sharon Landis. And we have 2 upcoming webinars where you can hear a lot more in a lot more time than what I have today. So we have our first one on October 20th, and we have a repeat of that same webinar on October 31st. And we'll provide information, overview of the scope of work for Family Support and Connections. We'll explain that request for application process, and we'll provide an opportunity to address any questions anybody may have. I am going to give all of this information in a neat little packet for James to distribute to you all as well. So you have the links for those webinars, you'll have the request for application solicitation number, and you'll have Sharon Landis's contact information for any questions that you may have. Thanks so much.
Whew. Wow, Tina, that was good. That was fast. But yeah, I'm just going to say, there's also grant funding available if you want to help people file their taxes. I'll have more information. So we'll be in contact. Thank you for your time. I know people have to run. I have to run. So great to see you all and the various Doom Bombers as well. So thank you for all your work.